Salama that I am in the airport and I came and I must come. You are highly welcome, and we appreciate too much your chair, his presentation about restless leg syndrome, insight from animal models to the human being.
Thank you so much to this chairman, and thank you for organizing committee and Dr. Sharma. He's not here, but thank you so much, everyone. I'm Kazuhiro. Today I would like to I'd like to talk to restless leg syndrome, especially for animal model to understanding for pathophysiology of restless leg syndrome. As you know, restless leg syndrome has 4 major symptoms as you move and begin worse during resting time. And symptom partially totally improved movement or walk. And symptom will last in evening or beginning of sleep. And 3 supportive features there: family history, cognitive therapy response, and periodic improvement. But these patients have most important problem is too difficult to sleep, staying asleep. Not adult people, not only adult people, also pediatric patients, they show their symptoms like this. Movement of their legs or similar to this. They say sometimes they say small insect movement of their legs. It's quite easy to understand their symptom. So restless leg syndrome is quite common disease because prevalence is very high. In European people, 10%. Asian people, a little bit less, but still 5%. So we hope to understand pathophysiology of this. But although this is common disorder, but we cannot understand completely this pathophysiology. But 2 major pathophysiology considered. One of them is neuromuscular dysfunction, and one of them iron insufficiency. Treatment, at first iron administration is recommended, but this is limited for individual which has low iron or aging. And second, dopamine agent is quite effective. Many kind of dopaminergic agonists produced several companies. So next, we go to animal model for animals. So some group produced animal models. For example, reasoning model or iron insufficiency model or pharmacological intervention model. But several kind of like this kind of animal model, but we cannot consider the symptom and we cannot explain the pathophysiology. One of the iron deficiency hypothesis I explained. As you know, some patients shows low iron or protein level in serum, and also CSF. So we can easily consider to improve by iron administration for improving their symptom. So, why iron is important? The answer is this. Iron is coenzyme to produce dopamine. So, children high pictures needs for iron for the activity. So, this is the reason why iron is important. So, several groups produce iron insufficiency model. But we cannot completely understand the pathophysiology yet. Second, A11 hypothesis. It is quite impressive hypothesis because A111 dopaminergic neuron, this group is only area to produce spinal cord their action. So spinal cord in spinal cord dopamine concentration is depends on A11 group. One group produce this mice, so they disrupted A11 region. This region is very small, so it's difficult to distinguish, but they can disrupt this way. So A11 is those are hypothalamic area, so project to spinal cord their action. The result, region model show hyperactivity compared to normal. And also, in addition, region mice under iron insufficiency condition showed more hyperactivity, quite different. And in addition, they treated some drug free. So they use D3 agonists they use after using, so mice improve their activity. But other agonists were D2 antagonists worsen their activity. So third, D3 receptor hypothesis. So this is also important hypothesis because A11 area neuron projects to spinal cord, and spinal cord in the spinal cord, the D3 receptor density is highest where A11 project neuronal area. So some group they produce D3 are knockout mice. These mice shows also hyperactivity. And also pharmacological studies, D3 administration was increase movement. Six graphs are there, but important is only one. This file, D3 are knockout mice, and compared to only D3 knockout type and under iron insufficiency. So before sleep time, D3 are knockout and iron insufficiency condition mice shows hyperactivity compared to only D3 knockout mice. So D3 knockout and iron insufficiency condition caused to sleep sleep difficulty. And they also checked thermal sensitivity. This is hot plate. Yes, this is hot plate test. They performed, and these are D3 knockout mice. So iron insufficiency condition D3 knockout mice shows hypersensitivity to hot pain. also wild type is local sensitive, not so sensitive. So from this slide, I changed the talking direction a little bit. Several years ago, two groups performed genome-wide association study, and they showed some associated gene locus identified. One of them, Ireland group, they show BDBD9, this one, they show this syndrome associated to BDBD9. And at the same time, German group identified the other locus, 1, 2, 3, 4 locus associated, they say. But it's problem, all genes electronic variant, so not exon region. So, and I show other studies, right? This several years ago, we developed novel gene trap system. So this system is quite useful to get novel genes. For example, any kind of cell line, and we infected retrovirus vector. So easily retrovirus vector integrated cell line genome region. But I don't know which region the trap vector integrate. And trap locus gene function depends on trap on locus. The cell changes their phenotype, and after removing this trap vector by correct combinations, so they return the previous phenotype. So we get several kind of abnormal morphology colony we get, and we can identify the trap gene locus. After this experiment, I got this clone. This is parental line, and middle panel is trapped clone. This is quite different staining synaptophysin. And after pluricombinant, so that is trap vector removing, they return to parental phenotype. This mutant occurred to BDBD9 locus. So we consider BDBD9 associated to some vesicle function or neural morphology. And next experiment, we use knockdown assay. With digital cell and BDBD9 siRNA treated. So trapped mutant cell line similar phenotype destroyed. So synaptophysin staining is very weak, and also this mutant line synaptophysin staining. Next, we transformed truncated BDBD9. So truncated effective, not so big. So they show normal phenotype. So after this project, we considered to produce BDBD9 knockout mice. So then we produced this knockout mice. And same time, other group may produce same gene knockout mice. unfortunately, they published format than us, but their BDBD9 knockout mice shows hyperactivity during sleep time in mice. This is a movement scoring panel. Also, knockout mice shows hyperactivity in sleeping time. Also, wait. And this knockout mice shows pain response hypersensitivity. So compared to wild type, the knockout mice very sensitive of hot pain. And this hot pain hypersensitivity improved administration no dopamine agonist. But complicated data also get. So this knockout mice shows high iron level compared to knockout. This is controversial in human phenotype. They are not sure the reason why. But striatum no change and serum iron level is high. And some data we already got it also I showed. This knockout mice shows very small body weight. Depending on aging, the difference is bigger. Both male and female also smaller than wild type. And we checked these knockout mice muscle strength. So we continue to trial. Wild type improved second trial, but knockout mice did not improve. So they can easily fall down from weight. And we measured dopamine concentration and also metabolite. In the striatum data, dopamine concentrate is lower than wild. And metabolite also lower. And serotonin is not significant difference. So this panel describes conclusion. So several potential animal models already developed, but all models not understanding completely for RS phenotype. So we need any researcher need to more completely understanding animal model to produce. And especially sleep assessment and development of altitude phenotype was needed. And PLMS or spinal cord sensitivity and pain schedule. This point or investigated. So we continue to analyze my knockout model and complete with hope and expect completely understanding of RS possibility in future. So my hometown is here near Tokyo, from 100 from north. And my collaborator, German collaborator. Yes. And finally, I want to show, I want to tell small information. So, several years ago, we produced neuron-specific recombination claim model. This mouse called tau-cre mapping mice. These mice express cre recombinase only neuronal tissue. Not neuronal tissue, cre recombinase does not express. And in brain, only neuron got the neuron. For example, glia cell or oligodendrocyte, or the other type of neuronal cell does not recombinate. So, if you are looking for any mice for neuron specific recombination, please tell me. We can offer this mice line. Thank you for watching.
شكرا جزيلا للدكتور بروفيسور Kazahiro for his interesting and scientific lecture about restless leg syndrome. وطبعا احنا بنرحب بيه جدا في اسكندريه. It is pleasure to come to Alexandria in this time in the year. This is the most beautiful time in Egypt, especially Alexandria in the autumn. It is a beautiful area in the Alexandria now. It is pleasure to stay for a few days in Alexandria. And now we open the discussion for any question to Dr. Kazahiro. حد عاوز يسأل أسئلة عن الدكتور كازاهيرو؟ هو الريستلس ليج سندروم فعلا هو عندنا في the restless leg syndrome, Dr. Kazahiro, it is not evident too much in the Egypt. Although to say it is about 10% in European countries, but in Egypt it is very few, maybe less than 1%. Parkinson's disease is very evident; it may reach to 10%. But in Egypt, it is. I saw few cases all over my life. But maybe other professors will saw another patient. You see, Dr. Jamal Ahmed.
Thank you, Professor. How about the role of clonazepam in the treatment of restless leg syndrome?
Yeah. Sorry, in Japan, not so much medication permitted. So that medicine we cannot use.
You cannot use. You cannot use.
Yeah. Yes.
Why?
In Japan, government quite restricted so many kind of medicine we use. So usually, normally, after 10 years in US or European countries permitted, after 10 years we can use. Very, very big time lag we have. So it's difficult.
هو I saw one patient with restless leg syndrome where I used the Cefrol, some more. It's very effective. It is very effective in restless leg syndrome, but in doses maybe 1 to 2 milligram daily completely cures the patient. About 1.5 to 2 milligram per day.
In case of RS syndrome, so quite low dose dopamine agonist is effective, but some patients low dose agonist not effective. So we need increase to agonist volume, but if we need so much volume agonist, so side effect also occur. So its adjustment is very difficult. But most cases, very low dose is effective compared to Parkinson.
Kazahiro, please, what is the difference between animal models of Parkinson and restless leg syndrome regarding the site of the lesion? As you know, both are affecting the dopaminergic system. Regarding Parkinson, there is a definite localization of the site of the lesion, substantia nigra, striatum, and so on. This is not evident in restless leg syndrome, though it is the line of treatment is the same. Can you specify the site, primary site of the lesion in restless leg syndrome, the same as in Parkinson?
Yeah. Some human evidence by post-mortem brain lesion MRI study or ultrasonography is striatum. The patient striatum shows low iron concentrate, but I don't know. Parkinson patient, the striatum is low iron or high iron, normal iron. I'm not sure, but let's look. This patient, some patients shows low iron. So one of responsible area is striatum, but striatum neuron not project to the spinal cord. Spinal cord project only here. So restless legs, in case of restless leg syndrome, is quite complicated pathophysiology we have to consider. So not only striatum, not only A11, but not only spinal cord. So many so much area we have to investigate. So, but one of most responsibility area, I see, A11, I believe.
Okay. Thank you very much. So this is the end of this session. Now for a couple of days, and later we have the other session.